Hello, I made this information video for people who may be interested in lingual braces. Lingual braces are fixed orthodontic appliances that are attached to the inside surfaces of the teeth and so are completely invisible when viewed from the front. I've treated many patients with Incognito lingual braces, and I must say that they are one of my favourite orthodontic appliance systems. They allow us to straighten teeth and create beautiful smiles, yet are completely invisible from the front of the mouth. Just like traditional braces, we're able to use Incognito to exert pressure and move teeth, and being fixed, we can move the teeth bodily more effectively than with a removable appliance like Invisalign. Also being fixed, alignment can be achieved without dependence on patient compliance, so the patient has less to think about during treatment. The precise control allows us to treat cases that would be difficult or too unpredictable with Invisalign. Lingual braces are not a new invention and have been used since the 1970s, but until Incognito was developed, they were actually falling out of favour, with fewer dentists and orthodontists using them 15 years ago than in the early 1980s. The early lingual braces were more uncomfortable than normal braces. Treatment took much longer, adjustments were more difficult and less well controlled, and results were not as good as with traditional braces. The reasons for these difficulties were predominantly as a result of using prefabricated, standardized lingual brackets and wires, based on techniques that were effective with normal braces, but did not work so well with lingual braces. The Incognito system addressed these problems by making customized brackets and wires. This means that every bracket and every wire has been custom made to fit one patient with a specific treatment aim, so the appliances were far less uncomfortable and worked considerably more efficiently. Accuracy is the other important factor that, in my opinion, makes Incognito better than competing lingual systems. More accuracy is required in the manufacture of a lingual appliance than one that goes on the outside, as the appliance is further away from the tooth surface we're trying to align. So inaccuracies in manufacture become magnified and control of tooth position becomes less predictable. We have now moved to a completely digital workflow, so instead of taking the traditional impressions to have appliances made, we're now taking 3D scans of the teeth. This is not only more comfortable and faster than impressions, but also enhances the accuracy of the manufacturing process, resulting in a more efficient treatment. That is, a treatment that's better in terms of time and results compared to other lingual systems. Generally speaking, the initial adaptation to Incognito is still harder than with normal fixed braces or Invisalign, but once you're used to them, then they are actually quite comfortable. I've treated several patients with Incognito in one arch and Invisalign in the other. Invariably, these patients preferred Invisalign over Incognito at the beginning of treatment, but after a few months, they preferred Incognito because they didn't have to think about it. It was fixed in place and did the job without the patient having to remember to take them out and put them in after eating and drinking. So, if it's important for you to have a brace that other people can't see, then in my opinion, Incognito is the best system currently available. Incognito lingual braces have meant that patients can now often get results as good as, if not better than with traditional braces, in a similar or shorter amount of time. The downside of lingual braces is that they are likely to have an effect on your speech when they're first fitted. In 9 patients out of 10, speech goes back to normal within the first few weeks. However, 1 person in 10 will end up with some kind of a mild residual lisp throughout the duration of treatment. Again, like other fixed braces, patients who have Incognito will need to pay extra attention to cleaning their teeth, as food does tend to get stuck around the brackets and wires. The brackets are bonded onto the teeth, and even though the bond is quite strong, the idea is to make it relatively easy to take the brackets off once treatment is completed, So all fixed braces, Incognito included, need a degree of care in terms of dietary restrictions to avoid breakages and therefore emergency visits. You will need to avoid sticky foods like toffees, hard crunchy foods such as nuts, and tough chewy foods like steaks. The idea is to be sensible, so for example, you can eat steaks, but just cut off a smaller piece than you normally would, so it requires less chewing. Obviously, these dietary restrictions do not apply to a removable appliance like Invisalign, which is probably the biggest advantage of Invisalign. Incognito lingual braces are very effective as arch expanders as well, so many cases can be treated without having to resort to extraction of permanent teeth to make space. If extractions are necessary to improve facial profile in patients whose lower faces are already too full before treatment, then Incognito can be used effectively for these treatments as well. Like after all other kinds of orthodontic treatment, you will need to have retainers at the end. Current thinking is along the lines of lifelong retention, and I recommend having fixed retainers on the top and bottom front teeth whenever possible, on the inside so they don't show from the front, and a removable retainer for nighttime use, at least in the upper arch. Thank you for watching this video, and I hope that you found it informative and useful. If you would like to find out more, or to come in for a consultation, then please contact us.